Hi everyone, welcome back to the Aurora Blueprint. Today is the first of a series of episodes where we thought we'd have a chat to specialists in their own fields about dermatology, anaesthetics, obstetrics and gynecology, and a few others. A lot of women do get worried about hair loss after weight loss surgery, so we wanted to demystify what happens in that process. So I'm delighted to be joined by Dr. Sarah Page. Sarah is a dermatologist from Stratus Dermatology and Laser in Claremont with expertise in hair and scalp health. So Sarah, thank you for coming on today.
Thanks for having me.
Wanted to start off with, why does hair loss happen?
I mean, we see in the clinic all day long, every day, I see lots of people with hair loss, and it happens for a variety of reasons. The main reason, obviously, in your context is weight loss, and weight loss of any amount, if it's significant, can trigger hair loss. The main reason is with the hair loss cycle, most of our hairs are in a growth phase, and when we get more and more hairs into the resting phase, which is called telogen, we start to appreciate hair loss. So if you're in under about 15 or 20% of the hairs in a resting state, you probably don't notice it. It's just a normal shedding process. But as you go into that higher amount of shedding, then we start to notice it and people start to get very stressed and worried about it, which is understandable. Weight loss is definitely a trigger. The other triggers that we see in my clinic particularly would be iron deficiency, zinc deficiency, thyroid disorders, and then other mental stresses. So any physical or mental stresses, I say to the patient, can be a major trigger for hair loss.
And particularly for weight loss patients.
Yes.
Does everyone get it, or some proportion of patients?
I would say a reasonable number of patients would get it. I don't think everybody's going to get it. And it really also depends on how rapid the weight loss is. So that's what I see in the clinic as well. If people have had a significant amount, we usually say more than 5 to 10 kilos, within a shorter period of time, you will notice that they do start to get hair loss.
And I guess we see that in our patients because particularly after weight loss surgery, on average, a patient will lose about 30% of their total body weight within 12 to 18 months. Mm-hmm. So it's a huge deal for our patients, particularly given the majority are female, and so they do see this a fair bit. Yeah. But is it purely the surgery, or is it nutrition, stress, hormones, or something else?
I think it's a combination. It's never going to be one thing in isolation. If you just think about it at a biological level, it is the hair follicle. So the hair follicle can be influenced by lots of different things. And if you're pushing it into this phase called telogen phase, which is the resting phase where it actually falls out, all of that combination can occur. So I say to people, yes, you have to look at everything. So if you're looking at the nutrition side, it's basically you're providing fertilizer for your hair. If you don't have the fertilizer, your hair won't grow. And the body just doesn't care about hair, skin and nails to the same extent as other internal organs. And so often you'll find that your body prioritizes other parts of you, and that your hair is the last to get, often is the last to sort of, come to the party, I'd say. Yeah. So that's the other thing. So I'd say to people in the clinic, the main things that I'd see which would cause hair loss would be changes in hormonal states. So pregnancy, breastfeeding, come on or off the contraceptive pill. Oh, yeah. 2, nutritional, and the number 1 thing I see is iron deficiency in our clinic. Number 3, weight loss. Number 4, changes in other drugs. So things like prednisolone, these sorts of drugs coming on and off them can trigger hair loss as well. Yeah. Right.
And you mentioned there was telogen effluvium, but are there other causes as well?
Yes. I mean, I think telogen effluvium is a classic one related to your patients because that is the way that the hairs are sort of falling. It's the immediate type of hair loss. But remember, it's never immediate. It's always a 3-month delay because the hair loss cycle is quite slow. So people often don't know what to attribute it to because they'll find, okay, well, I had this hair loss, but it was 3 months after the surgery or 3 months after the stressful life event or whatever it is.
And which nutritional deficiencies would be the biggest culprits? Is it iron or protein or zinc or something else?
It's always a combination, but for me, I would always find it would be iron. When I see patients for this condition, I do full hormonal screen, iron, zinc, vitamin D and thyroid, and then whatever else I thought would be appropriate. But I would say iron would be the number one thing I see in my practice.
Yeah, okay. I'm so glad you said that, because we do all of those blood tests before surgery, but also at 3 and then 6 months and 12 months, and then annually they get another blood check.
Yeah.
So that's good to know. We also, I reckon in my practice, about a third would get some degree of hair loss. So on day of discharge, I give them this little discharge pack, and there's a silk bonnet in there, and that's something I thought might help from a physical perspective to help decrease hair loss at night. But more from the supplement side, are there any supplements or medications that can be used?
So I don't generally recommend any specific supplement. I think all the studies that I've read is really just to replace what's nutritionally deficient. And so I think that's why having, not taking your average hair, skin and nails formula is really a waste of money, in my opinion. I think you should be tailoring it. So if you're vitamin D deficient, take a vitamin D supplement. If you're iron deficient, have an iron infusion or take iron supplements. But yes, not taking it just anything, not taking. I just think you can save yourself a lot of money by actually just tailoring it to what your needs are.
Yeah. And I think the dietitian in our patients plays an enormous role in that too.
Yeah.
So of the over-the-counter hair growth products, like I've had some patients ask about the Rogaine type things that they could put on. Any of those help at all?
So, Rogaine, which is minoxidil, is the actual drug. It's a stimulator of hair. So it's best thought of, and I explain this to patients, a little bit like a fertilizer. So it isn't going to change the hair growth cycle, which will need time to change, and you will have to, if you're vitamin deficient, you've got to, replace that. But it does help promote hair growth. The only caveat with it is it does initially, at the very start, cause a little bit of hair loss, which is quite scary for some people, because what it does is it actually promotes the growth of long terminal hairs. And so it actually pushes out all the tiny baby hairs that are never going to be able to reach their full potential. So you will get this light hair loss probably for the first month to 6 weeks, and then the hair starts to thicken up.
Right.
But the thing about minoxidil is that you do need to continue to use it in order to have that growth. So if you're using it for telogen effluvium, you would need to be on it for a period of time before you came off it, and some people may decide to continue using it. But I think that's the number one thing, is that because they're in that hair loss cycle, to give them something that's making their hair fall out a little bit more can be quite scary, but you just have to sort of have to walk them through it.
Yeah. For example, if you've had weight loss surgery and this patient is, say, 4 or 6 weeks down the track, and they start to notice that hair is coming out in clumps when they brush their hair, things like that, what's some of the first things they should do?
I think the main thing is to just realise that this is actually just it is somewhat of a natural process. If you've had mass weight loss, that a lot of people will have the hair loss. To not panic too much, because in almost all cases, you're not going to lose all your hair. It is just a percentage of hair shift. So if you think about, normally you've got only 15-ish% of hair in the resting state, and then when you get to something like telogen effluvium, it's pushing up over 30-ish%. So that's why it's noticeable hair loss, but that it will reset in time if you give the hair time. Okay. The only problem is with hair is it's delayed. So it takes 3 months to come on. It takes 3 to 6 months to correct. So you do have to be patient. Right. Be gentle with your hair. I mean, you can still dye your hair. You can still straighten your hair, wash your hair. You don't want to be pulling on your hair too much. But honestly, it's not actually going to make a huge amount of difference, because it is at a hair follicle stage. So a lot of people come to me very stressed about what shampoos they're doing. Are they washing their hair too many times a week? I just say to them, look, your hair is going to do what it's going to do. It's a hair follicle problem. You can style your hair, do whatever you like whatever makes you feel good. The hair follicle just needs to catch up.
Yeah. I know you can't really give a specific time frame, but how long does it take for the majority of the hair to come back, say, after weight loss surgery?
It all depends on the amount that you lost to begin with.
Right.
So, and also it depends a little bit on how thick people's hair is. So very fine hair would not be as noticeable, the amount of hair loss, etc. I would say to most people, just expect that it might take 3, 6 more months, even up to a year to fully get back to your normal hair.
And do people ever get permanent thinning of hair?
It depends. So there is a condition called chronic telogen effluvium where people continue to have sort of stuck into that loss cycle. And so with those sorts of patients, they are worth seeing a specialist because sometimes it takes a little bit of effort to get people out of that hair loss cycle. I think the other thing I just wanted to mention is that not everything is telogen effluvium. I mean, in this case, the majority would be telogen effluvium. But what I find in my practice is that people often have a couple of different sorts of hair loss. So the telogen effluvium unmasks another type of hair loss that's there. And the majority of that sort of hair loss would be something called female pattern hair loss, where people get primarily thinning on the top of their scalp, whereas telogen effluvium would be more at the front. You would tend to get more loss at the front, whereas female pattern hair loss more on the vertex of the scalp or crown of the scalp, yeah.
Right, okay.
So then that type of hair loss does often, if it's bothering the patient, they might need some help with that, medical help with it, yeah.
And do you see hair loss in patients that have had weight loss with medication as well as those that have had surgery?
Yes.
Yeah.
Yes. Any sort of weight loss will do it. Yeah.
Yeah. Okay. So to recap, it sounds like the hair loss in the majority of patients is temporary. Mm-hmm. It does come back, but it takes time. Mm-hmm. Any take-home tips that you'd like to give to our patients? I think
the main thing I speak to patients about is, as much as possible, don't stress, because stress does make it worse. And the majority of people will correct. If you feel that you are not correcting within a period of time, so it's taking more like 6 months, 9 months, a year, there are people who can help you. But as long as you're addressing all the common things that might be causing it, so weight loss, nutritional, physical and mental stress, if you're looking at all of those aspects, it should come back, yeah.
Well, thank you for that reassurance. I know that's really going to help a lot of our patients. Thank you for your time today. I really appreciate it. Thank you, Dr. Page.
Oh, thank you for having me.